of value-based care here at Health Texas. I am a nurse by trade. I've been a registered nurse for over 30 years now, so I do come from a pretty extensive medical background. And I'm looking forward to just talking to everybody today and being able to answer what questions I can at the end of our session. So at this time, we'll go ahead and get started. All right. So the topic for today we're going to discuss is autoimmune diseases, just 101. We're going to look at some very basic diagnoses that fit into this category, some symptoms and treatments, and then if we have time, we'll certainly open up for questions. Keep in mind, as I said, I'm a nurse, I'm not a doctor, so the questions that are presented, if I don't know the answer, I will say that I'm not sure or don't know the answer. I don't want to give anybody, information that's not completely truthful and accurate. So we'll get started at this time. So the goals today, we just want to understand what autoimmune diseases or disorders are. We're going to review some of the most common disorders. We'll talk about some symptoms and triggers that may cause these disorders to either appear or exacerbate. We'll look at some lifestyle and workplace strategies to manage these diseases, and then we'll talk about any resources and support tools that may be available if you have any additional questions. So this is kind of high level. What is the immune system? I want to try to break it down. I'm not trying to teach you anatomy and physiology here today, but just want you to understand what the immune system is so that we can then talk about immune system disorders. So if you think about the immune system is your body's first line of defense against germs or toxins. The immune system is what protects you from getting sick. It helps you heal if you're either sick or injured. And there are ways you can strengthen your immune system if you eat correctly, exercise, get sleep. I think you hear that about a lot of things when we talk about our health, and I don't know that we put enough stress on the fact that good food, exercise, and sleep does help with a multitude of health issues. So, usually anytime we have the opportunity to speak on any of these disorders, a lot of it goes back to basically what you eat, what you do, and do you sleep enough? So the immune system is actually made of like three primary components. We have the thymus, and the thymus is an organ that's in the neck, and it produces T cells. T cells are those little attack cells that are in place so that if you are attacked by a germ or toxin, the T cells will go to that area and start producing and hopefully can help attack and minimize the disease or the infection that's going to get caused. The next part of the immune system is bone marrow. I know a lot of you probably heard about bone marrow transplants and bone marrow diseases. The bone marrow is just that soft, spongy stuff in the center of the bones. Our bone marrow doesn't look much different than the bone marrow of a pig bone or a cow bone. So if you're familiar with those, with ribs or other bones in other mammals, it's that real squishy, spongy stuff in the middle. And in the human, that is what is primarily responsible for producing our blood cells, including red blood cells, our white blood cells, and platelets. And if you look at this, they produce approximately 500 billion blood cells a day. So the bone marrow is very busy, and it's very busy keeping us healthy with these red, white cells and the platelets. Then we also have the lymph nodes. The lymph nodes are the small little bean-shaped part of the immune system that filters lymph fluid. It traps bacteria, virus, and cancer cells. And if you wonder where your lymph nodes are pretty much everywhere you have a blood vessel, you're going to have lymph nodes running pretty much in the same area. The main areas you can find clusters of them are, of course, are in the neck, in the armpits, and in the groin. And if you think about what they do, they're running that lymph fluid throughout the body, and they have the little filters in place. And so as bacteria or viruses, cancers are running through your lymph system, they hit those filters, and then you'll start to see potential swelling. So sometimes you'll get a little nodule in your armpit or your neck or your groin. And a lot of times the first thing that physicians will look at if you go to see them because you have swelling in your neck or your groin or your armpit, they're going to start searching for infections first, and then if there's no infections, they're going to start looking for illnesses. So what is an autoimmune disease? So normally our immune system is in charge of being that defense mechanism against the bad things, the toxins, the bacteria, the virus, those things that are going to attack the body and weaken our systems. However, in an autoimmune disease, our immune system mistakenly attacks healthy tissues. So it can't really distinguish what is our own tissue, our own body parts versus those external things like the toxins and the bacteria. So, because it can't determine if our own cells and our own organs are ours or if they're external, the body starts attacking itself. It's kind of a rare phenomenon. I think we're seeing more and more that there are more immune diseases that are being discovered. And if you think about the mechanism of the body basically attacking itself because it doesn't know the difference, you can understand how these diseases are also sometimes very difficult to treat because we don't really know what triggers all of a sudden you're healthy, you're doing fine. And then one day your immune system gets confused and then it starts on the attack and starts attacking healthy tissue, healthy organs. And then we have all of these autoimmune diseases as a result. As I said earlier, autoimmune diseases in general is increasing, not just in the United States, but worldwide. We are seeing more and more people being diagnosed with the autoimmune diseases, and there are actually millions of individuals affected worldwide. And because of this, we are seeing more discussions in situations and environments such as today in the workplace, in healthcare in general. You see it in nursing school and med school. Anytime we have a disease process that is on the rise, and certainly it's going to be talked about more in the community and in the educational environment. One of the things to keep in mind too is autoimmune diseases for some reason impact women more than men. So if you look at some of the diseases that I have listed here, you can see that lupus attacks women 6 to 1 times more than men. Rheumatoid arthritis in adults is 3 times more than in men. The juvenile rheumatoid arthritis is 2 to 1, MS is 2 to 1. Diabetes is one of those that's actually kind of one-on-one because diabetes type 1 is based on a lot of different factors, not just sex. It's more of a 1-to-1 ratio. And then you can see the other issues there as well. But the majority of autoimmune diseases are going to be striking women much more prevalently than the male population. So there's a couple of categories with the immune disease, and you can have it systemic or localized. And systemic just means it's happening all over the body, multiple organs, multiple areas of the body, or you can have it localized, where it's just a single tissue or a single organ. So when you're thinking about how the autoimmune system works, we have these cells and we have our lymph system. It just depends on at a particular time what body part the immune system is suddenly seeing as a threat, that it's no longer seeing that body part as part of us, it's seeing it more as an external factor. And so it's sending all of these cells there to attack, whether it's your thyroid or whether it's your liver or whether it's your bone marrow. It's really just dependent on the type of disease that is impacting the body at the time. So, kind of the crash course on the immune system, and we talked about that a little bit earlier. The key components that we're talking about are bone marrow and T cells and B cells. So, if you look at the bone marrow, if the immune system mistakenly attacks the body's own blood-forming stem cells, so that's when your bone marrow seems to self-attack, you get an insufficient production of the red cells, the white cells, and the platelets. And when that happens, that's when you can get the aplastic anemia or myelofibrosis. So there's a couple things that will, come into play. Of course, if you think about what does anemia look like and what does it feel like, you're not producing those blood cells the way you should be. You can have weakness and feel tired and fatigued. You can have excessive bleeding because you're not clotting well. So there's a lot of things that can happen when we have our immune system attacking itself in the bone marrow. The T cells are what we call the warrior cells. They're kind of the central drivers of the autoimmune disease, and they can act as the culprits to initiate the tissue damage, or they just fail to maintain the regulatory systems in the body. So you'll see that sometimes with diabetes and MS. It's not necessarily that they're initiating tissue damage, they may just not be working correctly anymore. And so you end up with diabetes, you end up with MS, and some of those other types of diseases. And then the last type in the immune system are B cells, and those are the antibodies. And the immune system can attack the body with the B cells because it feels like maybe something is foreign. So it's going to send all the antibodies there to help fight against the foreign, what it determines to be foreign. And then you have things like rheumatoid arthritis or lupus or MS. So at the bottom, I did put a couple of slide clips in there. You can see with multiple sclerosis, some of the things that happen. It can affect your brain, your speech, your digestion, your muscles. So, when we start dealing with MS, that's when your T cells are just in that attack mode, and it really does affect multiple organs. The second clip in the middle, that's your rheumatoid arthritis. That's pretty late stages. I'm sure everybody's probably in their lifetime seen someone who is suffering with rheumatoid arthritis. And you can see, especially in the hands, because that's most visible, you can see that the hands are deformed, the joints become swollen, and they can be crooked. And this is very painful for a patient to suffer from rheumatoid arthritis. And then on the right, that's showing that kind of rash that you see that is, some call it like the butterfly patterned rash. And a lot of times you'll see that across people's face if they're diagnosed with lupus. And I think a lot of people may remember the singer Seal. He has scars on his face, and he was suffering at one time in his life from lupus, and ended up with the scarring and the butterfly pattern on his face. So let's talk a little bit about things that can actually trigger autoimmune disease. Sometimes the trigger can be environmental, so it could be chemicals such as heavy metals, industrial solvents, pollutants, pesticides, mold. and cigarettes. So if you think a lot of those, depending on your workplace, a lot of people may actually be um, exposed to some of these triggers in the workplace if they're working around, solvents, pollutants, metals, pesticides. You also have to keep an eye on mold, whether it's in the workplace or in the home environment. And then, of course, cigarettes. And cigarettes is not just a matter of smoking yourself, it could be secondhand exposure if you live with a smoker, if you work in an environment. For instance, I can remember a million years ago when I worked on an ambulance, I always worked with people on the ambulance that smoked, and you would be in the ambulance, multiple times a day with the windows up because I lived in Florida. And I'm sure over my lifetime, I've inhaled a lot of secondhand cigarette smoke just because of exposure, not having even been a smoker myself. Second triggers can be viral or bacterial infections. So things such as COVID, flu, enteroviruses. So those that you get that are like GI viruses, even the Epstein-Barr virus can trigger the body to start attacking itself. Now, that doesn't mean that everybody that experiences one of these infections will actually have an autoimmune response because of it, but those are some of the things that they're able to link the autoimmune response to. Also, drug reactions, like there's some blood pressure medicines that don't that do react with each other. Some rhythm drugs. A rhythm drug is just a cardiac drug that helps maintain that steady rhythm of your heart. Some antibiotics, and then some biologics as well. And then another thing that can also trigger autoimmune disease is sunlight and radiation. And we're not talking definitely not talking about full-on radiation exposure from like a meltdown. Potentially people that work around radiation. That's why you see people that are doing X-rays and different things all day are always wearing their lead-lined protectors. And that's one of the reasons is we want to protect our bodies from that exposure that over time could be more than our bodies could manage. And then again, sunlight, good sunlight, we all need sunlight, we all need sunshine, but when we get to the point that it's too much exposure, then it can trigger an autoimmune response. So, what kind of symptoms do doctors look at when they're first examining a patient to try to decide, is this an autoimmune disease or is it something else? So, these aren't the easiest kinds of issues to diagnose. Sometimes it's a matter of ruling out everything else and then coming up with a list of, actually what are the symptoms and seeing, can you tie it back to something specific? Or is this really something that's more on the autoimmune spectrum? So, generalized joint and muscle pain, fatigue, brain fog, skin rashes, digestive distress, numbness and tingling. So, a lot of times it takes a long time to really get to the bottom of what is truly an autoimmune disease. So, if you think of something like a skin rash, you go to the doctor, you have a skin rash. First thing you're going to do is probably give you some cream, throw some cream on it, come back and see me. Then you go back and see them and the cream's not helping. So let me give you a steroid shot and come back to see me. And then you go back and it's still there. And they're like, well, let me just put you on some um, long-term, oral steroids for a little while and let's try that. And you go back and they're like, okay, I can't do anything with you. Let's send you to an allergist. So you go to an allergist and they do some allergy testing and find out you may have some allergies and they may want to try to treat that. And then with treatment, it still is not, getting any better and you're still having skin rashes. And so they say, well, maybe you need to see dermatology. And then you go to and they don't know what to do with you. And then maybe eventually you go to like a specialist like a rheumatologist or immunologist that can really drill down to say, okay, it's not all this other stuff. So maybe it is an autoimmune disease. So you can see as a clinician, diagnosing some of these diseases are very frustrating, but also imagine as a patient, you just keep seeing people and they keep kind of offering an opinion, but it may take quite some time to actually drill down to, what is the real cause of the symptoms. So I think that's something to keep in mind if you do suffer from an autoimmune disease or you're familiar with someone that does. Know that it's not something that you just walk in, like you take a test and they say, oh, you have COVID. Okay, go home, feel better. It may take weeks to months sometimes to get a good solid diagnosis. And in the meantime, the patient is suffering the symptoms. The coworkers may be suffering along with them. It may make you moody. It may make you depressed. It could affect your work life, your family life. So we just need to be patient and keep that in mind when we are working with people, or if we're going through these issues ourselves. And again, why is it difficult? Because the symptoms may overlap across multiple diseases. It could mimic stress. It could mimic infection. You have to rule out all the infections. It could be just somebody may say it's just part of aging. When you get old, you're going to start having more pain, or you're going to have numbness and tingling in your joints, or you're going to have this, you're going to have that. So it takes a lot of time, and it takes a really good, thorough evaluation from a clinician, that's willing to take the time to do all of the rule outs and figure out, okay, it's not this disease, it's not this, it's not this, it's not that. Okay, now let's go down this pathway. And what you typically don't start with, you don't go to a PCP and then jump right into an immunologist or a rheumatologist. That just typically doesn't happen. They're going to try to rule everything out before. And then once you get to the point that they say, okay, I'm not really sure, that's typically when you get sent out to a specialist. And I say that to say, if you're having any of those type of issues, it's really important to let your physician know everything that's going on with you, right? They need to know all of the symptoms, all of the things that are happening, so they can look at the whole picture. Yeah, I got this rash right here on my hand and it's not going away. Well, what else are you having? Well, maybe you're having some brain fog. Maybe you're fatigued. You need to let them know all of those symptoms so it gives a good clinical picture, and then they can start going down that pathway to diagnosing you correctly, and then potentially getting you out to specialists that they may need to, so that you can be treated. Oh, I think we did this one. So we were talking before about the women representing 75% of the diagnoses, and a lot of hormonal shifts can influence severity. So sometimes as women go through different changes in their lifetime and hormones become balanced and imbalanced over time, that can also influence the severity of an autoimmune disease. So we'll just look at a few of the most common autoimmune disorders. We'll look at the thyroid, we'll look at lupus, MS, rheumatoid arthritis. Somebody did send in questions ahead of time about Crohn's disease. Crohn's is a difficult disease as well, and we'll touch on that. I think we also, Heather said that we had last year did a whole presentation on Crohn's. And if anybody in particular wants a copy of that, if you will email Heather after the presentation, she can get you that copy over too. And we'll talk about why I put the asterisk by that when we get to it here in just a little bit. So thyroid disease is actually an autoimmune disease. A lot of people don't really realize that, but it is. There's a couple of types of thyroid disease. There's the Hashimoto's, which is the underactive thyroid. And if you look on the lady next door, you can see with hypothyroidism, that means that your thyroid is just not working correctly. And when that happens, your metabolism is lowered if your thyroid is underactive. You can get hair loss. You can't really think clearly. You may get a goiter where your thyroid starts getting enlarged and you can actually see or feel it on the front of your neck. You can have a slowed heart rate. Fatigue, sensitivity to cold, dry skin. You can gain weight if you think about the fact that your metabolism isn't working properly. Even with the same intake that you may have had your whole life, all of a sudden you're starting to put on weight for no reason. Puffiness, memory problems, constipation. Again, if you think with this underactive thyroid, everything slows down. You could get irregular menstrual periods, PMS, depression, mood swings, joint muscle pains. Your cholesterol can go up. Um, with this, a lot of times that can be treated with medication. They can just give you medication to help supplement your underactive thyroid to get it up to a level that is normal. And then the other side of that is Graves' disease, and that's an overactive thyroid. So if you think about Hashimoto's, everything with your metabolism slows down. With Graves' disease, your metabolism is super overactive. So you can still get hair loss. You can also get eye bulges, heart palpitations, tremors, heat intolerance. You can't sleep, you lose weight, you're short of breath, you got diarrhea, you eat all the time, but you can't maintain your weight. Again, your irregular menstrual cycle, muscle weakness, sweating, anxiety, nervousness, depression, mood swings. So if you think of those, they're total opposites, right? And ideally, you're right in the middle. Your thyroid's working correctly, and your metabolism is in a normal range. But if it's too low, everything works slow. If it's too high, everything works very quickly. And so with the underactive thyroid, you can take medication to get it stabilized, and sometimes that's all you need. On the flip side, if your thyroid is overactive, depending on what's causing that, sometimes they can take it out and you have to be on medication your entire life. They do offer a pill that's radioactive iodine. And so what they try to do is figure out what a normal level for you would be. They give you the pill and they want it just to kind of kill off a little bit of your thyroid so it's not quite as hyperactive. Of course, a lot of times if they don't get that exactly correct, then you end up with hypothyroidism and then you have to take the medication. So um, sometimes you have the same kind of things with cancers that'll affect your thyroid the same way. The advantage is you can live without a thyroid. You can take medication to replace it if you don't have one or if it's underactive. So this is one of the easier treated autoimmune diseases that you can have. Next, we'll look at lupus. Lupus is just that chronic systemic autoimmune condition where the thyroid or the previous autoimmune disease with the thyroid is pretty localized. Lupus is really systemic. It can affect a lot of different things, including your skin, your joints, your kidney, your heart. So you can see with like, and they were comparing lupus with COVID. So lupus, you have more in women, and with the COVID is more men. Um, you have some antibody issues with lupus. You have plasma cells that are affected. So there's a lot of pathological changes with lupus. You look on the other side with the COVID, the SARS antibodies, the respiratory syndromes that are a lot more prevalent in men. And then you have that kind of blending in the middle where you have blacks and Hispanics that are more likely to have both. You may have some lymphopenia, some tissue damage, and this is one of those conditions that's really not easily reversed, and it's also difficult to diagnose. So if someone is having a lot of symptoms, this is one of those diseases for sure that you may start with your PCP and they may start ruling out a lot of different disease processes, but it may take some time to get you to the right doctor that can give you the right diagnosis for lupus. The next one we'll look at is MS and rheumatoid arthritis. With MS, the body attacks the myelin on your muscles and on your neurons. And so you have some neurologic and some physical symptoms with this. If you see people that have MS, it's kind of degenerative. It will get worse with time. There are medications that may help slow it down. There are some other treatments out there that may not be traditional that may reverse some of the symptoms. But typically, this is a chronic condition. Over time, you tend to have more neurological symptoms, numbness and tingling in the extremities, muscle weakness. You may have some neurological changes. And again, there are things to slow it down, but not necessarily something that's going to put it in full remission for long periods of time. We also have rheumatoid arthritis, and that's when the body's attacking the linings on your joints. Most visibly, you can see that, as I showed you before, in the hands and fingers. You get the pain, the swelling, the deformity. Again, a lot of times with this disease, it's treating the symptoms. It's not necessarily a reversible disease, so the physicians will treat the actual symptoms, the pain, the anti-inflammatories, the pain medication. There are some, if it's severe and it's really debilitating, some surgical interventions at times for rheumatoid arthritis. But those, again, it just depends on the physician and who's treating and what their treatment plan would be for specific diagnosis. So, at the request of somebody that had sent in questions talking about Crohn's disease, we can talk about that a little bit. I put the asterisk there because if you read some articles, you'll see that Crohn's is definitely an autoimmune disease, and then others are like, well, it could be, but it could be other things. So I just put the asterisk there, but we'll certainly talk about Crohn's disease. It's an inflammatory bowel disease. It's caused by an interaction between the immune system, dysfunction, genetic predisposition, environment, rather than a single direct cause. That's why I put the asterisk, because it's not necessarily always immune disease. It could be triggered by an immune response, but it could be bacteria, virus, or autoimmune with the body attacking itself. So some key contributing factors, of course, is the triggers by the immune disease dysfunction. You get inflammation in the digestive tract. There's also a strong relevant cause through genetics. So that's one of the things, if you're having chronic irritable bowel and you see your primary care physician, if you have family members that have already been diagnosed with Crohn's, that would certainly be something you would want to share with your PCP so that they can take that into consideration when they're looking at a diagnosis. Environmental factors, gut bacteria. Some bacteria is good, some bacteria is not good. You have to have the right amount in your gut to maintain gut health. And so there are environmental factors that will also negatively impact your gut health. Again, smoking can contribute to Crohn's, as well as some medications, including the nonsteroidal anti-inflammatory drugs. I know there's an off and on discussion all the time about the ibuprofens and the naproxens and the link between taking those chronically, long-term, and Crohn's disease. So there's a lot of research out there, and you can certainly look that up. Some of the things that I like to look when I'm looking for, there's a couple of websites I like to look at. One is Cleveland Clinic. They have really good peer-reviewed journal articles on different disease processes, as well as Johns Hopkins. So if there's anything in particular you want to look a little bit further, make sure that we're not using Dr. Internet because, everybody's got opinions and you can find all kinds of crazy stuff on the internet that will lead you down a rabbit hole. So if you do go out and want to do research on anything like this, I would try to stay away from some of the other people that are offering opinion and stick with those large groups, Cleveland Clinic, Johns Hopkins, um, even Memorial Hermann has pretty good articles. Just make sure that you're doing research and you're looking at real information and not just junk science if you're looking this up for yourself. Crohn's disease, again, if you look at the symptoms, you can see this is very difficult typically at the beginning stages to diagnose because the symptoms can be very vague. General abdominal pain, you may have diarrhea, some rectal bleeding, feeling tired or fatigue, joint pain, nausea, vomiting, anemia. And if we go back and look at the other diseases that we already talked about, those are kind of the same symptoms, right? For a lot of them, pain, diarrhea, feeling tired, fatigue, joint pain, anemia. So it's really important at that first conversation with your primary care provider that if you're having these issues, really be specific, be able to speak to it, how long, what does it feel like? Does it come and go, or is it all the time? Talk about your diarrhea, be able to really give them a good picture so that they can get you to the appropriate specialist if needed so that you can have your symptoms addressed quickly. Treatment for Crohn's, there's a few things that you can do. They will prescribe a lot of times medications to treat the symptoms, not necessarily cure the disease. For abdominal pain, they can give medication if you're having cramping or diarrhea. There's not a specific diet for Crohn's. However, it has been recommended to not have milk, alcohol, spices, and high fiber foods because those do tend to exacerbate or make those symptoms worse when you do consume those items. There may be some over-the-counter supplements. If there's a really bad crisis with the Crohn's disease, you may have to have IV feeding so that you're getting the food products through an IV rather than having to digest them if you're especially having a lot of pain and diarrhea. There are surgical options from going in and taking out a bad section of the bowel to maybe needing a colostomy. So there's a lot of things there. And then, of course, again, lifestyle changes. And part of the lifestyle changes, if we look back to the previous slide with the contributing factors, some things you can fix and some things you can't fix, right? You can't fix your genetics. You can't change it. There's nothing you can do to alter your genetics. There may be some things you can change to improve your environment or your gut bacteria. Definitely, you can look at, smoking cessation, and then, of course, also not taking the non-steroidal medications chronically. And it's kind of a vicious cycle. You have pain, you take a ibuprofen and it gets better, and then it gets worse, and you take ibuprofen and it gets better, and then the next thing you know, you're chronically taking these these non-steroidals that actually could be leading to a worse case of the Crohn's symptoms. So again, just be honest with your physicians if you're having any issues. They need to know everything. What are you taking? What have you done that makes it better and worse? And then are you willing to make any kind of lifestyle changes that may help improve your condition? So living with autoimmune diseases, the treatment reality is there's not a cure for most autoimmune diseases. The provider can try trials of steroids or medications. They can try immunosuppressants, chemo, some biologics. But again, with these diseases, there's typically not an actual cure. They do a lot of treating the symptoms and reducing your immune activity over time, and then symptom control. So again, your PCP may not be as well versed in treating true autoimmune diseases, so you may have to go see a specialist that can help work with you with your symptom control. So as far as lifestyle, as immune support, it's about living well. If you can live better and live well, it can help support your immune balance and your overall immune system. And as I said earlier, sleep, movement, nutrition, and stress reduction. And I'm not sure about everybody on this call, but that's one of the hardest things because work, it seems like work and stress go hand in hand, right? We go to work, we're stressed. We go home, we're stressed. We get up and go back to work, we're stressed. The weekend comes, we try to de-stress, but typically something happens and we're stressed again, right? So it's a matter of finding the balance to your life, finding out how to reduce some of that stress in your life. I know most employers have good EAP programs, so you can get that extra support if you are stressed and need help working on some of the work-life balance issues. And again, get your sleep, eat well, and exercise. That will certainly help both physically and mentally, and also help with the stress reduction. So how do we address stress and trying to counteract the autoimmune response at the workplace? So there's a few things that we can do that will help support immune health at work. Take breaks. I don't know how you are. I'm terrible. I'll come in the office at 8 o'clock and sit at my desk, and sometimes I'll look at the clock and it's noon and I haven't even gotten out of my chair for 4 hours. Make sure that you can schedule stretch or movement breaks. If you're in a classroom, stand up and teach from time to time, then sit down, move around, stretch in between classes. Sometimes just bending over and touching your toes, grab your ankles, put your hands over your head and just do some stretch and movement. Another thing that's really important is stay hydrated. I know in this day and time, it seems like everyone's got a great big Yeti cup of something that they're drinking all day, and that's not a bad thing. Make sure that you're drinking your water. If your water gets empty, go get a refill. Have some stress reset techniques. Figure out what works when you get stressed. It could be getting up and walking up and down the hall. It could be deep breathing for 5 times. It could be 2 minutes of meditation. It could be 2 minutes of complete quiet. You don't want to talk, you don't want to hear. Find out what works for you and then figure out how you can incorporate some stress reset techniques in your day. Look at some anti-inflammatory snack choices. So anti-inflammatories, when I think of that, I think of berries. A lot of blueberries, strawberries, raspberries, blackberries have really high anti-inflammatory properties. So think about, instead of grabbing that Hershey's chocolate bar or grabbing a Kit Kat, maybe grabbing some fruit and snacking very healthy during the day. And then respect chronic illness accommodations. If you work with people that deal with these chronic illnesses and they have to have special accommodations so that they can continue to do their job, you have to show respect for that. We don't know what other people are going through. A lot of these autoimmune diseases are really invisible to an outside person. They don't know what it feels like to be in the body of somebody that has an autoimmune disorder. So we need to show some grace and some respect for people that are going through this, and respect the accommodations that may be made for them in the workplace so that they can continue to work. There are some supplements with some scientific evidence behind them that may improve the immune system. Of course, you always want to speak with a physician, even if you're starting out with over-the-counter medications, because some over-the-counters will actually have interactions with prescription drugs. So I always say, when you see your PCP or your provider and they want to see, they'll say, bring me your medications. Make sure that you're showing them any supplements that you're taking as well. Some of the things that may help with the autoimmune response is vitamin D, probiotics and gut health medications, and the omega-3 fatty acids. Those may help boost the immune system and help in the situation of the autoimmune response. But again, make sure that your physician knows what you're taking and to be open if you have a physician that is wanting you to try some of these supplements to use in conjunction with your healthy diet and exercise and the other things that you're doing for your health. So just some key takeaways. Just know that autoimmune diseases are very common, but they're also extremely complex. They may be hard to diagnose, and a lot of times they're even harder once diagnosed to treat. Know that symptoms can vary widely depending on the type of autoimmune response. It could be as simple as a rash or fatigue, or it could be full-blown pain, nausea, vomiting, anemia, diarrhea. There's a multitude of symptoms based on the type of disease. That management includes medical and lifestyle support and changes. So you may have medication to treat the symptoms, but there also may be some lifestyle modifications that can help as well. And then work environments can help reduce triggers if you do call into play some of the things that we talked about, moving, stretching, hydrating, reset when you feel stress, picking the right snacks, and respect others that have the autoimmune diseases. Make sure that we are aware that people may be suffering with autoimmune diseases and you may not even know because it doesn't show externally. So again, we just want to make sure that we are, appreciating and respecting any accommodations that are made for our coworkers that are suffering from these diseases in the work environment. So I can now open for questions. If anybody has any questions that you'd like to ask, we can do that now.
If you have questions, you can place them in the chat or you can take yourself off of mute to ask the questions.
I have a question. My name is Rebecca. I've got about 3 different things. Gluten sensitivity, alopecia areata, and now I'm dealing with arthritis. And then I'm seeing a rheumatologist for that. And so it just seems like, of course, I've gotten rid of the wheat and got rid of dairy. I've got rid of everything. My thing is more, I just want to stay on track and make sure my diet, it seems like my times when I have buckled down and stuck with it, with the diet, I feel better, but just, and I just don't want my arthritis to get worse. I've got a lot of the little, starting to get the little, I'm 65, so I'm already starting to get that first joint in the finger is getting bigger. So I want it to stop. Just as far as the diet, the anti-inflammatory diet, that's more my concern right now.
Yeah, and I think that's really important. And I know just from working, it's hard to eat healthy at work, especially, right? Because you have to plan ahead of time. Then you have to make sure that, you have your food. Is it prepped? Is it, do you have everything you need? Did you leave something at home? Oh no, what are we going to do? There are a lot of resources out there for, and again, I would recommend the Cleveland Clinic website. You can put in autoimmune diet and it will give you a really good plan. You can pull diet plans. But I think, one of the important things, it's funny that gluten is one of the things that recently has come up that can cause a lot of issues. I know we push milk a lot, but milk is one of those things. If you think about milk, and we want our kids to drink milk and have milk, but we're the only mammals that actually consume milk outside of infancy. And it's just kind of wondering, why is that? Why are we so dependent on milk? And that's one of the things that they look at. And they actually, when I was tested a while back for an autoimmune system, one of the first things that they tested me for was a milk allergy. And guess what? I had a milk allergy, and I didn't know that till I was 50 years old. So I think, when you're looking at those things that it's saying, cut down on some of the things that may irritate your system, just really look at those and then have that conversation with your provider. I mean, I think we don't talk about diet enough and what is a good diet for all of the things that's wrong with us as individuals. It would make sense for you to say, well, you need to cut out this or that because you have to consider what diagnoses people have. So I think that's a great question, and I would definitely have that conversation. If you have a rheumatologist or an immunologist, I would pin them down and ask them, okay, what's the best diet for me to keep my disease processes in check and to keep me as symptom free as possible.
Well, she did suggest vegan, but that
Mm.
is it's kind of difficult. But I
Or,
have
well,
a lot
yeah,
of,
because we're in Texas and we don't really vegan here, right?
yeah,
But
I've
there
been,
are benefits to that, and maybe if you can't live true vegan, can you be vegan 2 or 3 days a week? I mean, if you think
that's a
about
good
it, it's
that.
it's it's easier to say, okay, I'm gonna commit to start with one day a week, I'm gonna not eat meat, and then get through. And what you can't do is say, I'm not gonna eat meat, so I'm gonna eat junk food. That's not the trade-off, right? If you're not gonna eat meat, then you need to replace your meat with a good vegetable-based protein. You can't decrease the protein. You're just gonna change where you're getting it from. But that may be something you want to try, and just try it one day a week and see how you do, and then maybe 2 days a week. There is a question too in the I see, what kind of accommodations can you ask for? So depending on the disease. For instance, some people with Crohn's disease have to have specific accommodations based on, and this kind of gets out there, but sometimes when you work and you have Crohn's, you're going to be in the bathroom a lot. And you need to make sure that your work understands that and can accommodate. If you are teaching and you need to leave your classroom, how are they going to help accommodate that so you're not leaving your classroom to take care of your physical problems, and not leave kids unproctored for a period of time? If you're dealing with multiple sclerosis and now you have to work with a walker, do they have handicapped accommodations in your facility? So I think that's really based on, um, what the actual disease process. I would say for things like your thyroid, that's something that you can kind of manage on your own. You get your thyroid the way it needs to be, and you probably don't need accommodations. But for some of the more debilitating, look at the rheumatoid arthritis. There are different tools that are made for people. There are special tools that help people with the bad arthritis like that in their hands, that can use pens or chalk or different things to write with, to eat with. So that would be something, and I would probably discuss that with your HR department. If you feel that you do need some type of work accommodation, that's certainly something that is under the HR department, and they could certainly help you out as well with those. Any other questions while we're here?
Yes, there were some other questions. How is the testing done to find out if you have an autoimmune disorder? Is it done by blood work?
Yes, and actually, Lisette answered that correctly. Yeah, a lot of blood tests. So, for instance, if you, like I said, if you go in with a rash and they're going down that autoimmune, you may need allergy testing. You may need specific thyroid testing, because there are some thyroid conditions that will manifest in different kinds of rashes. You may have to have, if it's a bone marrow type issue, then you may have to have your CBC and your hemoglobin and everything checked. So again, it may be multiple blood tests to rule out everything else, rule out cancer, rule out diabetes, rule out rule out a lot of stuff before they actually get to where they need. And again, your immunologists and rheumatologists are the ones that really get into that very specific blood testing that can really target some of those very unique disorders.
There's another question on how is RA tested?
I'm gonna look that up on my notes because I do have that. Um, there are some blood tests for antibodies that they can check. A lot of it is clinical, so they're gonna get that whole picture. What are your symptoms? There are some antibodies specifically for rheumatoid, so there's a factor in your blood that they can test for. I'm telling you that that is not something that you're gonna get at your basic PCP examination. They're not gonna say, okay, I'm gonna just send you for all this test. They're probably going to do that preliminary testing of just general blood work. If everything looks okay, then they're probably going to send you out to that specialist who's going to take it to that next level. They'll do a full comprehensive physical exam, a medical history and symptom exam, and then pick what type of blood tests they want to, if they are suspicious of the rheumatoid, they're going to look at that rheumatoid factor and some other very specific blood tests and enzymes and things that will point directly to those. There you go, your A&E. We have somebody that knows about it. I'm glad to see that. Yep. All right, I have 1 o'clock, so we'll go ahead and wrap things up. Heather, if you want to just give them your email address one more time in case they want the Crohn's program from before. And I think that'll be it for the day. I appreciate you guys attending and hope to see you again soon. Oh, Heather put there's her email address in the chat box. So it's heather.williams@healthtexas.org. So if you do want that presentation, she can get that out to you. And I appreciate your participation and hope to see you again.
Yes, thank you for joining us. And just a quick reminder, we do have that health talk next week on the 27th on MSK and low back pain. So hope to see you guys there for that health talk as well. Thank you for joining us today. Greatly appreciate it.
Thank you all. Have a good day.
Bye.